Within the COVID-19 limits, of course, we are lucky to enjoy right now. Your commitment to protecting yourselves and each other from the spread of this virus is simply wonderful. So is your respect for the advice from Dr. Fitzgerald and Minister Heck. People continue to receive the COVID-19 vaccine here in the province as they arrive, and they'll be getting into the arms on a priority basis, as has been previously described. Next week, residents of long-term care homes in the province will start to get vaccinated, and we're so happy we're in a spot to be able to report that. In terms of the Indigenous communities in the province, the Nunavut government is starting to vaccinate next week, and the Innu Nation the week after. Labrador Grenfell Health is working with the Nunavut Community Council to vaccinate residents in isolated communities like Norman Bay and Black Pickle as well, which is set to happen within days. Sure, masks and physical distancing and proper hand washing practices may be around for quite some time yet. But with the vaccine and the level of normal life we are already enjoying here in this province, things are looking really good for more and more normalcy in the months ahead. Just keep up the good work and don't let your guard down. The temporary changes to the Atlantic bubble I announced back in November, then extended through the holiday season, are one of the guards that we collectively have as a province against the spread of COVID-19. Today, I am extending those changes for another month. That means people traveling into Newfoundland and Labrador from our neighboring Atlantic provinces, PEI, Nova Scotia, and New Brunswick, must self-isolate for 2 weeks on arrival. They don't need a travel exemption, and there will be no changes to Dr. Fitzgerald's special measures orders at the Labrador border right now either. Basically, things will stay the same as they have been for the last 6 weeks or so. We continue to watch how our neighbours are doing in our adjacent provinces and maintain close contact with their premier and their public health officials. Newfoundland and Labrador, we are getting it. Please continue to wear a mask, keep your distance, wash your hands, and respect all public health guidelines. It is an honor to serve as your premier, and I thank you for your sacrifice and everything that you are doing. Last night, watching Alex Newhook and Dawson Mercer join Team Canada in the gold medal game at the World Juniors, I was filled with a sense of pride, as I'm sure many of you were as well. As their family and friends watched with the rest of us from home, whereas I'm sure they'd rather be ringside. I know I want to be ringside when my son Mark is playing. It struck me that this is what it's like to live in a pandemic. We have so much of what we're used to, but it's just not quite the same. I know it's a sacrifice, but your sacrifices are helping keep Newfoundland and Labrador safe. Thank you, and congratulations to Team Canada for bringing home the silver medal. We're all so incredibly proud. I'll now invite Dr. Fitzgerald to share her update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have no new cases of COVID-19 in the province, and there's one person in hospital. Our total number of cases is 392. 376 people have recovered, and we have 9 active cases. And in total, we have tested 73,775 people. So today marks the 12th and last day of Christmas, or Old Christmas Day, as it is known to many people in Newfoundland and Labrador. As we anxiously await to see if the holiday season has impacted the incidence of COVID in our province, each day that passes without evidence of spread is a small victory for all of us. And while it is easy to focus on the low daily case counts, that is not the sole indicator by which we must measure our success. As I've said before, it's not the cases we know of that concern us as much as the cases we don't know about. I am concerned that there may be people out there who are symptomatic and have not come forward for testing. This may be because they don't believe they have come in contact with COVID, or because they are afraid. They may fear the reaction of their friends, family, or community. They may fear the reaction on social media, or they may simply fear confirmation that they do in fact have COVID. If you or a family member have a fever or new cough, please call 811 to arrange COVID testing. If you have any two of the following symptoms, please call 811 to arrange for COVID testing. That's shortness of breath or difficulty breathing, runny, stuffy, or congested nose that's not related to your allergies or other causes or conditions, sore throat or difficulty swallowing, a new headache, an acute loss of your sense of smell or taste, unusual fatigue or lack of energy, new onset of muscle aches, loss of appetite, or vomiting or diarrhea for more than 24 hours. Please note that many of these symptoms can be quite mild, and please don't assume it's just a cold. We have seen outbreaks and community spread happen everywhere in the country because people were mildly symptomatic and didn't limit their activity or get tested. And I realize this is very different than what we've been used to doing. We take great pride, I think, in pushing through even if we're sick, but this is not the time to do it. Please stay home if you are sick, and please get tested. It is essential to know that we know of any cases of COVID so that public health officials can do their job effectively and well and contain the spread of the virus as much as possible. While the holidays are behind us, COVID remains in full force outside our borders. We must continue applying our layers of protection. The special measures orders for gatherings are still in effect with a maximum of 20 people permitted for informal indoor and outdoor gatherings. And we continue to recommend having no more than 20 close, consistent contacts. As the weather becomes more harsh and unpredictable, people will inevitably spend more time indoors. So as we carry on living with COVID, please remember the phrase people, space, time, and place. So the more people you interact with, the greater the risk that COVID can be transmitted. The closer you are to others, the greater the risk of spread, so make sure you can physically distance. The more time you spend with others, the greater the risk of spread. And indoor activities with others are more risky than outdoor activities. We need to continue applying our layers of protection as well with our own public health measures. Wash your hands regularly and well, or use hand sanitizer. Maintain at least 6 feet from those who are not your close contacts, even when you're wearing a mask. And wear your mask in indoor public spaces. For anyone who is accustomed to vacationing in warmer climates during the winter and spring, please know that non-essential travel is still not recommended as the risk of contracting COVID is significant. For anyone who has received the COVID vaccine, all the public health measures still apply, including the requirement to wear masks in public spaces and to self-isolate when returning to the province from travel outside. While the COVID vaccine offers protection to those who have received it, we need real-world evidence to determine how effective the vaccine will be at preventing transmission of the virus between people. The information and evidence on COVID vaccines is evolving, and as with everything else COVID, we must align our actions with the evidence and evolve with it. It has been almost 10 months since COVID took hold in the world, and I know it can be quite daunting to face the prospect of the winter months ahead in the midst of the pandemic with all of its restrictions and uncertainties. Now more than ever, we must focus on our mental health and well-being. So while it is important to stay informed by paying attention to trusted local and timely sources, keeping up with the flow of information from across the country and the world can be overwhelming. Be selective about what you take in and know that it is okay to tune out from time to time. Do not be afraid to leave your house. There are many ways to socialize and participate in your community in a manner that is safe. It is okay to spend time with close family and friends or to join an activity. Take advantage of any good weather that comes our way by getting outside for fresh air and exercise. The simple act of going for a walk has helped me personally get through some difficult days. We will all need positive thinking to help us through this, but I know for some positive thinking just won't be enough. So please do not be afraid to reach out for help if you are experiencing worry, sadness, or loneliness. Help is available in many ways for people of all ages and circumstances. Please visit bridgethegap.ca to access age-appropriate programs and services that are available locally, confidential, and free. If you are feeling anxious and alone, you can also call the Provincial Warm Line at 1-855-753-2560, 7 days a week from 9 a.m. to midnight, to speak with a trained peer support worker who is there and ready to listen. If you or someone you know are experiencing a mental health crisis, please call the Provincial Mental Health Crisis Line at 1-888-737-4668 to speak with a mental health clinician any time of the day or night. As a recap, for those who may have just joined, we have no new cases since yesterday's media advisory, and our total number of cases in the province stands at 392. Public health lives in communities, and as communities, we have responded to the challenges of COVID-19 superbly. I am so grateful to each of you for your cooperation and resolution to protect one another from the virus. The vaccine has given us hope for an end to all of this, but we need to hang in there a little bit longer with our tried and true public health measures. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now invite Minister Haggie to share some comments.
Thank you very much, Premier. Yes, it's Vaccine Delivery Day 22. It's the 6th of January, and for those looking at the calendar, we're just over 2 weeks now from Tibbs Eve and 2 weeks from Christmas Eve. And I think everyone is to be congratulated on a job well done. We have 0 cases, and that shows that, again, people of this province have stepped up, changed what they wanted to do into what they needed to do, and have helped keep COVID under control over the early part of the holiday period. As far as the vaccine delivery is concerned, the first trays of vaccine went to Eastern Health, as everybody I think knows by now. 90% of those first trays were administered prior to Tibbs Eve, and the remainder are being administered over yesterday and today. The second trays that were delivered will be starting second dose for those essential COVID workers beginning tomorrow. As far as the vaccine rollout itself is concerned, the next location to receive Pfizer vaccine will be Central, and those trays will be split evenly between Grand Falls, Windsor and Gander. And in each of those locations, the doses will be split between acute care and COVID essential workers and what we call congregate living areas, by which I mean, in this first instance, long-term care facilities in both those 2 towns. The rollout beyond that will kind of depend on which centre gets its next ultra-low freezer up and running. It's currently a race between Cornerbrook and Lab West. So the decision will be made about exactly where that goes. More than likely, it will be Western Health in the next delivery, but that is uncertain until we know the status of the freezer. One of the questions we get asked frequently is about numbers, vaccine delivered, whether it's Moderna or Pfizer, how much of that has been administered, and how many people have been vaccinated. We're working on our COVID dashboard, and we will have that available hopefully by middle of next week, and that will be updated on a regular, likely weekly basis thereafter that. For those of you who are interested in further details about vaccination, particularly around who falls into which of the NACI priority groups, I would direct you via the COVID-19 info page to the page entitled COVID-19 vaccine. There is a very comprehensive explanation there of phase 1 delivery, with also allusions to phase 2 and phase 3. And as those phases approach, those sections will be expanded to provide the information as we roll out our plans over the course of the winter. One of the other issues that has arisen lately, triggered, I think, by social media comments, is around the issue of travel. I think I've been fairly comprehensive in talking about travel within Canada and into the province that way. But the comments this week have been around international travel. I think it's important for everyone to realise that this is a federal government jurisdiction. It is not one amenable to provincial government input directly. There are international travellers who come for a variety of reasons. Just as we have our exemption system here, the federal government have them. So there would be family members coming for compassionate grounds, there would be people coming for work, there would be people with educational requirements, and there may also be, on the international stage, some refugees. They are governed by federal law, the Quarantine Act, and that is monitored by quarantine officers and federal officials. People who come into this province from abroad are required by the federal government to have an isolation plan for the 14 days. And the one thing that they do have through the federal government is, if you like, an exit test at day 12. They have to have a negative PCR before they can leave quarantine after the 14 days. The addition that the federal government have told us they are making is that for all travellers inbound by from overseas, they have to have a documented proof of a negative PCR test within 72 hours of their departure, their travel. That again is all federal jurisdiction and is something, if people have further interest, I would direct you to your appropriate federal government representative if you wish to input for changes or discuss that further. I think I just closed, Premier, by emphasising Dr. Fitzgerald's comments that this is the time of the year where people do feel unwell for a variety of reasons, often in a very mild way, and the tendency has been to soldier on and go to work. This is not something that should be done during COVID. And if you have the symptoms that she listed and that are provided in many locations on our daily bulletin, on the web page, these kind of things, you should seek a call to 811 and see if a test for COVID-19 is appropriate for you. And with that, Premier, again, congratulations to everybody for a good start to the holiday season. And I'll turn it over to you, Premier, for some closing comments.
Well, thanks very much, Minister. We'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Allison King with VOCM. Please go ahead.
Hi, emails about Kinderstart being canceled have been sent out to parents. Can you give us an update about that, and why would that be canceled if schools are going to be open?
We will certainly get that information from the Minister of Education. Presumably it has to do with COVID restrictions and bringing parents into the schools, which we know is a restriction that's ongoing currently within the education system, but we can certainly provide further details from Minister Osborne.
Thank you. And there's been some discussion in other provinces about the wastage of vaccines. Is that something that's of concern here?
I'm sorry, what?
I think we've done very well.
Okay.
Sorry, go ahead, Minister.
No, I didn't quite hear the question, Premier. Over to you.
The question was on wastage of vaccines. Whenever there's any kind of medical treatment, if anything, there's always a percentage of wastage that occurs. But we've got the utmost confidence in our public health officials to deliver this in an effective, efficient way with absolute minimal wastage. And they've already proven that they can do that thus far.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, good afternoon. The notion going around of single shots of the vaccines, I'm wondering, is this something whereby you would literally forego the second shot if it was actually entertained, or is it a question of relying on future shipments for that second shot rather than storing current shipments for it?
So certainly here, our goal is to stay as close to the recommended dosing interval as we can. There has been some discussion as to whether or not the second dose can be delayed to some degree in an effort to try to vaccinate as many people as possible in that with those first doses. However, nobody is straying from a 2-dose schedule. That's what's been recommended by the manufacturers. It's been recommended by the National Advisory Committee on Immunizations. as well as Public Health Agency of Canada. So certainly a 2-dose schedule is what we're aiming for.
Okay, thank you. And I wanted to ask about St. Pierre, where apparently St. Pierre Miquelon is scrambling to try to keep up with this federal requirement of PCR testing. Is there any discussion involving the province on this in terms of St. Pierre who need to come here for health care?
Certainly, Peter, I can deal with some discussions around that. My understanding is that there may be a lag with St. Pierre's ability to ramp up their testing numbers and capabilities to comply with the federal requirements. And we're working with various parties to see if we can help them fill that gap between now and the week or so that they think they need to be able to do it themselves.
Okay, thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
You mentioned in the preamble that you're going to be able to start vaccinations next week in long-term care homes. Does this mean you've been given approval to be able to use the Pfizer vaccine outside of the place that it's being stored?
Certainly, Pfizer has provided us with instructions on how to do that. So, yes, we will be redistributing.
And can you give me an idea of which long-term care homes are going to be up first? How many residents do you expect to be able to vaccinate?
That's an issue for the Regional Health Authority, and I would probably direct you to Central Health. It depends on the number of doses, and the apportionment at the moment is 50-50. So half of the central trays will go to Grand Falls, half to Gander, and of each of those sites, half will be allocated to long-term care and half to essential workers. So I think it really rather depends on the size of the long-term care facility. There are long-term care facilities in both of those communities, but additionally there are personal care homes which also fall under the definition of congregate living, and I'm not sure yet from the numbers as to whether or not that first delivery would have sufficient doses to do all of those categories in the first run.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, you noted in your opening comments about concerns about people not coming forward. Where are these concerns coming from, noting how many we're testing daily and with our great contact tracing we have?
So everywhere, really, across the country, we have heard, evidence that people aren't coming forward or are maybe underestimating their symptoms and therefore thinking that it's just a cold, it can't be COVID, that sort of thing. So it's really just from conversations that we've been having, and we realize that we are seeing that, and even in our own experience, we have seen that people are not really coming forward. Well, we've had instances of people underestimating their symptoms, we'll put it that way. But so, we've all had those experiences, and we just want to make sure that we're finding every case that's out there so that we can put a circle around those cases and their contacts and try to limit that onward spread.
Thank you. And for international rotational workers, they still can avail of the early testing like rotational workers can within Canada, noting that those are federal guidelines. But Nova Scotia is allowing international rotational workers within their province to avail of the early testing. Is this something we're looking to extend here?
So I'm not aware of Nova Scotia's regulations in that regard, but at this time, no, that's a federal OIC, and we can't override that.
Okay, thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. The decision to extend the current restriction in terms of the bubble by another month, was that made in consultation with the health authorities in other provinces or with other premiers?
That's something that we do now, and that's something that we've done from the beginning when we decided to, pull out of the bubble, if you will, and something that we'll certainly continue to do. We have regular discussions with the Premier. Minister Haggie has run regular discussions with his counterparts of the Atlantic jurisdictions, and as does Dr. Fitzgerald, and these are all conversations that we weigh in the decision to enter or withdraw from the. So that's something that will certainly continue.
And in terms of the vaccines that the province is receiving, are we keeping with this idea of distributing vaccines to provinces on a per capita basis versus where we see kind of the hot zones of COVID-19 across the country?
Again, those are discussions that are kind of ongoing, but certainly there's been no signal that it would move away from a per capita basis.
Our next questions are from Allison King with VOCM. Please go ahead.
Dr. Haggie, last briefing you said that the flu vaccine would be the model for the COVID mass vaccinations, but I'm just wondering what happens if school is not currently sitting, such as Easter and summer, for children being vaccinated?
If you recall, we did have a system whereby childhood vaccinations that would normally take place in school were done outside of school when school closed early in last winter. We have, for the first time this year, enabled students to be vaccinated in schools. So the system is there to adapt, and if the school is not open because it's summer vacation or whatever, then the fallback would be to do for the students what we would have done under a flu-style system. They go to the website, they schedule their appointment to suit themselves, and if they have challenges that render access to the web or using hardware difficult, there is a call centre number that will do it on their behalf.
Thank you. And doctors in Ontario are urging pregnant and breastfeeding women to get vaccinated for COVID-19, saying that the risks of getting COVID outweigh possible risks of the vaccination. I'm just wondering what public health's view on that issue is, especially living in a place with such low case numbers.
Yes, so there is information available for that, and certainly, in general, we follow the National Advisory Committee's Committee on Immunizations recommendations, and they say not routinely recommended, but it is a conversation that should be had between a healthcare practitioner and their patient as to whether or not the risks of COVID outweigh the risk of vaccination. And, these are theoretical risks. The main reason that recommendation is not because we expect that there would be issues. It's just that, unfortunately, pregnant and breastfeeding women weren't included in those trials that happened, as the vaccine was being developed. And so, that evidence will once again evolve, and in all likelihood, those recommendations will change at some point in the future. But right now, we are recommending a discussion, an informed discussion that will happen between anyone who is pregnant or breastfeeding and their healthcare practitioner to determine what is the best path forward for them. And of course, epidemiology is one of the considerations that you have to take into account when you're having that discussion.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Sorry about that. Do you have an idea yet where teachers and or school staff stand in the priority for vaccination?
So certainly at this point, conversations about the next level of priority groups are happening, and we are looking into that actively at this point. So we don't have definitive answers for that question at this point, but as soon as we do, we will certainly be transparent about that. That information will go up on our website. There will be conversations that will be happening about that. So I just don't want to speak prematurely about it at this point.
Okay, thank you. And actually, I just have a housekeeping question. What is the scheduling conflict that's preventing a live briefing on Friday?
As you can imagine, the three of us have multiple schedules to manage, some of which are personal, and we'll just leave it at that.
No, okay, thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
The province has only administered about 28% of the vaccines that we've received. That's lower than every other province except Manitoba. Why is our rollout so much slower than most other provinces?
I think the
That's not exactly accurate information there, Peter, first of all, but go ahead, Mr. Hague.
I think the confounding issue there, Peter, is that the Moderna vaccine has gone to Goose Bay for distribution in the territory of the Labrador Inuit land claims and the Innu First Nation in Natuashish. Certainly in the case of NG, Nunatsiavut, they have jurisdiction for public health. They had some challenges because the federal government and the manufacturer failed to provide any advisory material or pamphlets in their local language, so Nunatsiavut had to translate all those to help educate their citizens. In addition to that, there was a modicum of training, and then they, for cultural reasons, have holidays up until and including today, and they felt that that would impair their delivery. So they are going to start in NG on the 11th. Innu Nation have opted because of events recently in the community that have upset the well-being of the community to start their vaccination on the 18th. Labrador Grenfell and NCC will be starting with two isolated communities on the coast on the 11th. So that takes 2,400 doses out of the equation. If you look at my comments at the beginning, 90% of the vaccine delivered in the first trays was administered by Tibbs Eve, by the day before Christmas Eve. And the second trays are now being administered as of tomorrow for second doses for those people who were in that first tranche back in mid-December. So the numbers are slightly misleading.
And of course, I think we, as Dr. Fitzgerald has said, Peter, we need to, be cognizant of our local epidemiology and ensuring we get this right and have the faith and the trust in the public health officials to deliver this correctly. We're going to do it with a degree of urgency, but we have the faith in them that they can deliver this expediently but correctly as well.
You'd mentioned early on that the military was going to be involved in the vaccine rollout. What has their involvement been to date, and how do we plan to use them as the vaccine rollout continues?
They are active participants in the vaccine committee that we have. We have a dedicated liaison officer, and essentially they are there as a safety net currently. They are ready to be engaged at very short notice should we find something that would suit their skill sets and meets our need that we can't do ourselves.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. With the vaccines that have been administered within the province, have there been any reactions or, I suppose, major reactions to those doses?
No, to my knowledge, there haven't been many. The exact number of adverse events following immunization that have happened, I don't have, but we can certainly get that information for you. But, we're talking less than 5, I believe.
Thank you. And in regards to the protocol in administering the vaccine here, at the end of the day, when there's a dose or two left in a vial, how does that work forward, knowing that in other jurisdictions that it's been a bit of chaos? Here, I suppose we've heard of those of public health calling up to certain floors asking if anyone wants to receive it. Just wondering what the protocol is.
Well, certainly, our direction has been as minimal wastage. So, we would encourage the regional health authorities and anyone who's delivering the vaccine to, to plan as well as possible to make sure that, you have enough people, you get enough vaccine for the people that you need to vaccinate, and that there is very little left over. But if that were the case, that something happened that somebody couldn't get vaccinated that day or whatever, and they had vaccine, our opinion is it should go in an arm rather than be wasted. And so if that means that they have to find somebody to vaccinate who may not have been on the list that day, then that's what they do.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Just curious about, in terms of planning predictions for how vaccine rollout will happen. As future vaccines are approved by Health Canada, I'm thinking specifically the AstraZeneca vaccine that was approved in India, for example, will public health give an update in terms of the speed of the rollout and how things will go as those factors change?
Yes, so, as we get more vaccines, and, we anticipate a couple in the pipeline, and, I think certainly we'll be advising just how that will happen. It's really difficult to talk about specifics at this point because we don't know, even for some vaccines, if it'll be 1 dose or a 2-dose schedule. So, we need to have the information before we can do that. But certainly our goal is to be as transparent as we can and to have the public as well informed as possible.
Thank you. That's all for me.
Thank you. I will now go back through each reporter to see if you have one final question. Alison King with BOCM, do you have a final question?
Yes. I'm just wondering, especially when it comes to the distribution of the vaccines in long-term care homes, I'm just wondering where we're going to be able to find this up-to-date information on the rollout and just vaccine number updates in general.
That will be on our COVID dashboard as of some day next week. I'm hoping midweek, and that will be updated on a weekly basis. And we'll provide numbers of people vaccinated. We have not decided yet how far further to go with revealing numbers because of the risk with such small numbers currently of vaccine that are coming into the province of actually being able to identify the vaccine status of individuals, and I don't think that would be appropriate.
Peter Jackson with the Telegram, do you have a final question?
No, that was my final question, so I'm fine. Thank you.
Thanks, Peter. Peter Cowan with CBC, do you have a final question?
A question, when an election campaign happens, who's going to be managing the COVID response? Who makes the decisions about, for example, if it's time to decide whether to reopen the Atlantic bubble or if restrictions need to be loosened or tightened?
Okay, Peter, as you know, anytime there's an election period, the bureaucracy continues. The utmost faith in our public service officials that they will continue whenever there's an election to continue to provide the service that they've provided so well to date and will continue to provide in a writ period, no different than any other department within government.
Kellyanne Roberts with NTV, do you have a final question?
I do, yes. Through the pandemic, many people have had to pinch pennies. Many have lost their jobs. There's some concern with the economy here in Newfoundland and Labrador. With the recent departure of Mary Shortall from the economic recovery team, how concerned should Newfoundlanders and Labradorians be about potential cuts to come?
Look, Ms. Shortall leaving is disappointing. The people on that recovery team don't report necessarily to me. We selected a diverse group of people that would have input into an economic plan for the future. It's disappointing that she left, but I understand she made good contributions to date. What the economic recovery team is going to do is going to provide options for the people, options for government, options for the legislature, where we can all discuss with stakeholders to continue to move forward in how we see the economy developing in 5 and 10 years. There's no boogeyman hidden here. There's no lack of transparency. Everything will be very open when the report is available, and people can have discussions about it. But the fact that the economy is in the position it is in is not because of labor. It's not because of the hard-working women and men on the front lines, whether they be paramedics, teachers, firefighters, or civil service. That's not the reason we're here. So there's not going to be any massive issues for them. We all have to collectively look together about how to look at the economy moving forward. So even though her departure is unfortunate, because we want and we need a labor voice as we move forward with the economy, it's not a departure from what we had said from the very beginning. These are going to be options which are going to be discussed, nuanced with the legislature, with stakeholders, with the general public, and we'll decide what we want the economy to look like based on some of the options provided by this task force.
Thank you.
Patrick Butler with Radio Canada. Do you have a final question?
Yeah, just to follow to Peter's last one. Whenever we do see an election, are all three of you going to be at the table during that election campaign for this sort of briefing?
Well, we'll see what the epidemiology is at that particular moment in time, and if it's necessary, then for sure. But if not, then we'll see. We'll make that decision at the time.
Thank you, everyone. Premier, do you have any final comments for today?
Once again, thank you all for joining. Congratulations to Alex and Dawson. We're all incredibly proud. But I'd like to leave with echoing Dr. Fitzgerald and Minister Haggie's comments that it is a time of year where people tend to feel a little ill for numerous reasons, often the common cold. If you are feeling ill, please stay home. Do not spread it about the office. Do not soldier on. The proud and courageous thing to do currently is to stay at home if you feel unwell, not the opposite. If you continue to feel unwell at home, please seek advice from your doctor or from 811, and please get tested.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.
Say 10 minutes passed. It might have been 5, it might have been 10, it might have been 15, it might have been a half hour, I don't know, but it felt like an eternity. And finally, one of our teammates stood up, but came out and said, "I'm feeling it." And think about that, like he's feeling the pressure. So could you imagine in an NHL dressing room in a Stanley Cup final, before a Game 7, a member of the Pittsburgh Penguins sitting down and saying to the other guys, I'm feeling the pressure. How would the reaction be? How would the media take that? Obviously, it's probably not very good. But from my perspective, it's wonderful, because what happened to our team is the other three guys were like, yeah, I'm feeling it too. You know, I feel nervous, I feel stressed, I feel anxious, all to different levels. Like, I think all of us were feeling it, you know, some more than others. But really what that provided